Hello everyone. Today we'll be discussing a new topic, that is exodontia, literally meaning extraction. For a common man, oral and maxillofacial surgery means just mere extraction, which we all know which is not true. But extraction is the traditional symbol of dentistry. You would have seen many people, a layman, referring dentist is a person who does extraction of the teeth. And this extraction of the teeth as a profession was done by barbers centuries ago. So we will be discussing the whole extraction in this session. So coming to the contents. So first and foremost, we will learn the definition of extraction, which is very commonly asked in your Viva exams also. And after the definition, we will go for the indications of extractions, contraindications for extractions. So indications, almost some 15 to 20 indications are there which you should learn. And contraindications, local and systemic contraindications, where you should be doing it and where you should not be doing the extraction. You should be aware of that. Then mechanical principles of extraction, very important. That is the physics of extractions, what we will be discussing here. Then mechanical principles of elevators. We will be using some special instruments to elevate the tooth, to luxate the tooth, to make it mobile. Those elevators we will be discussing in this session. And then we will go into extraction forceps, maxillary forceps, mandibular forceps. So this all will be in your spotters also. So you should be very much aware how to identify and write few points regarding that. After discussing that, we will go into the radiographic examination of the tooth, which is indicated for removal. So based on radiograph, whether the tooth has to go for extraction or not, we will be discussing there. Then we will discuss the methods of extraction. Extraction can be done by two methods, that is open method and closed method, you can call it. The open method is called transalveolar method, and the closed method, what we do with forceps, is called as intraalveolar extraction method. Then once the tooth is extracted, we will discuss the post-operative care, what medications to be given, what instructions the patient should follow. And after doing that, we will discuss the complications of extraction, especially the dry socket and all. We need to learn about that. So this is in nutshell, I have given you an intro, what all we are going to discuss in this topic of extraction or exodontia. So coming to the very word exodontia or extraction, this gives tremor to the patient. Always the patient will be scared of extraction and scared of injections, because they would have heard from their family members or friends that it is a traumatic experience, but in reality it is not. It all depends upon the dentist, how he is doing it. So the fearful tremors is generally associated with the act of extraction. So we'll be discussing how to overcome this fear also. Okay, so now coming to the first extraction with an anesthesia was done by Dr. William Morton. Dr. William Morton, he was the one who did the first extraction with anesthesia, ether. And this was done in Massachusetts General Hospital, where he called everyone and he extracted his own teeth to demonstrate that yes, extraction is possible with the help of anesthesia. And after that demonstration, it went like a wildfire, and many more dentists came forward, and then they started inventing different types of anesthesia, local anesthesia, that gave a boost for manufacturing companies also. So now before we go into the indications and contraindications of exodontia, let us go into the history part. When did this all start? So historically, dental extractions have been used to treat variety of illness. If anyone had any infection anywhere in the body and the tooth is decayed, they used to think that remove the tooth, everything will be fine. So variety of illness The solution was extraction of the teeth. And during the Middle Ages, throughout the 19th century, this itself was not a profession by itself, but it was done by barbers and general physicians. So it was on a common platform. The barbers who used to cut the hairs on the same chair, they used to extract the tooth. So even today, if you look at the dental chair and a saloon, the chair what they have, lot of resemblances there. So it was not a profession initially, it was done by barbers and general physicians. And the main, what you say, the core of indication for extracting a tooth was to remove the pain. That's it. Pain gone, they thought everything is over, and any chronically, if a tooth is infected, chronic tooth infection, extraction of the tooth is the solution. So only extraction was meant dentistry in the initial days. So lot of instruments came into practice slow by slow. So in the early 14th century, a physician by name Guy de Juliet, he invented this instrument called dental pelican. This was the first and the foremost which is documented, dental pelican. And by this is very popular till 18th century also. It resembles like the beak of a bird. You can see the photograph also. It looks like the beak of a bird. So dental pelican was one of the first instrument which came into practice. After that, this dental pelican, it was used for removing the diseased tooth and was associated with great deal of discomfort. You can see this instrument here. If it is kept inside the mouth and when the key is given, it's difficult. One beak will be attaching on the root surface, another will be on the crown part, and when the key is given, it will dislodge the tooth. But by seeing the current the photograph, you see that it is definitely a very, what you call it, like a difficulty in extraction will be there, and it will create discomfort to the patient also. Then more development took place how to modify the dental pelican. Then the forceps came into practice. So forceps were one of the oldest instruments used in dentistry, and they had earlier other names like parrot's beak, crow's bill, and stork's bill. These were the other names for the dental forceps what we have today. So the dental pelican, the first instrument in 14th century, that later gave to dental key. This was an instrument which was modified by dental pelican and came into practice. So this dental key was the one, when the tilt is given, a handle was there. So it just resembles like your crossbar. When you give the tilt, the tooth gets extracted. Then this dental key, the handles were made by different materials, by wood or by bone or ivory, and were always set at right angles to the instrument. So this was the design which was incorporated later by later. Lot of invention took place, and then the instruments were modified. The working end consists of a bolster with a hinged claw. A hinged claw was there which you go and attach to the root surface. So what you see in the photograph, the bolster, it was placed against the root, and one part is attached to the root and the claw is attached to the crown part. And when the key is given, it will dislodge the tooth. Then the current 1765, around that time, this instruments, our current dental forceps were somewhere looking like this. So a slight curve was given in the handle or the shaft, which was developed with a distant bend. A bend was given so that you can hold it. So this is more of the instrument what we are using now, more resemblance is there. But this was in 1765. Then it was later in 20th century, the key was replaced. The key was replaced by the forceps, which are still in use today. What you are seeing it now, it is still in use. And the current day forceps are something like this, which you are all aware of. We have three parts of the forceps, that is the beaks, hinges, and handle. So you have a beak, these parts are very important. It will be asked in the Viva also. So you have a beak, this part is called hinge, and this part is called the handle, where you will hold the instrument. Three parts. So this is a Viva question also. So this is all about your history. So this is just of for the knowledge surface, knowledge point of view, you should be knowing it for the sake of knowledge. That's it. So now coming to the actual definition of exodontia. So in your Viva exams and in your theory exams, the questions can be define extractions, add a note on indications and contraindications of extraction. This is a very popular main questions for exams. So what is the ideal definition? Again, numerous people have given numerous definition. So this is the most accepted definition which you should be knowing it. So an ideal tooth extraction is the painless removal of the tooth. Definitely it should be painless. That is why it is an ideal. It should be the painless removal of tooth or the whole tooth part or the whole tooth with minimal trauma to the investing tissues. A tooth is there, in and around the investing tissues, there should be minimal trauma to periodontal ligament, to the alveolar bone, neighboring tooth, minimal trauma. So that the wound heals uneventfully, it will heal uneventfully, there should not be any inflammation and all. And no post-operative prosthetic problems is created. You don't have to go for an RPD or an FPD later on. So the tooth is extracted. So for prosthetic part also no complications is created. So that means all the spicules, everything are removed so that straight away the patient can go and get his tooth replaced. So I repeat the definition. An ideal tooth extraction is the painless removal of the tooth or the whole tooth or the tooth root with minimal trauma to the investing tissues so that the wound heals unevenly and no post-operative prosthetic complications or problems is created. So this is the definition. So now when you look at extractions or the surgery, it is here we are using principles of surgery. The basic principles of surgery, along with that principles of physics and mechanics are also involved here. So when it comes to extraction, you should know surgery, you should know physics, and you should know mechanics. Three different subjects, it is an amalgamation of that. And when these principles are correctly applied, you get an ideal tooth extraction will be done and the tooth comes out very easily. So that is the physics, mechanics and oral surgery. So now coming to the different types of extraction or exodontia. So basically there are two types, that is open method and closed method. What do you mean by open? Open means you are opening. So that means the tissues you are reflecting, the gums you are reflecting. With the burr you are going and you are with the instrument you are guttering the bone. With the burrs you are guttering the bone, handpiece you are using and you are sectioning the tooth and you are taking the root out. So you are using the burr, micromotors or and you are opening the tissues, you are reflecting the tissues. So it is open. So that is why it is called as open method. And the other name for open method is called transalveolar extraction. So this transalveolar extraction is always asked as a short essay also. Whereas the other type of extraction which we do routinely on daily basis, that means the patient comes, we give local anesthesia, we take the forceps and extract the tooth. That is called closed method or intraalveolar method of extraction. So your open method is transalveolar and your closed method is called intraalveolar method of extraction. So this is very important. You should be knowing about this. Then going into the indications for extraction, we will discuss in our next session. Thank you.